Hi, I am Dr. Bala from Hyderabad, India. I practice in Yashoda High-Tech City, Yashoda Hospitals, High-Tech City. I'm a senior neurosurgeon there.
Okay, thank you. Thank you for your introduction. So now I prepared several questions for you. How do you think of the future of UB technique? Because there are some people say that UB technique is the supplement to uniportal, and some people say it is the replacement of uniportal. So how do you say?
So I see UB or biportal technique is not a substitute or is inferior to monoportal, because we have many advantages here. The first advantage, if you see, the instrumentation. You don't need any special, very highly specialized instruments for it, and the learning curve is less. And for the countries like India, Nepal to that matter, where you have to keep the cost minimal. Sorry, I have to cut, I think. Sorry.
No, it's okay. We can modify that.
So where we have to keep the cost of surgery to the minimal. So such techniques are very helpful. And it's very easy to learn and teach. For example, such conference we are organizing in Nepal. So this helps to take this technique deeper into the areas of even in the tier 2 cities, tier 1 cities also. So it's not like that. And the advancements, especially if you see bonds, so they have come with advanced equipment, like the drill, the hooded drill, and the RF plasmas and what you use. So if we use in this thing, they are very safe, and these things are advancing, and they're not very costly when compared. I do monoportal a lot, monoportal transforaminal, but I don't see the monoportal is a bad technique, but it comes with its fallacies, or it comes with its limitations. The limitations being the cost. So every time the instrumentation needs to be repeated, they frequently get damaged. So the instrument is very cost. And we have limitations also with training and all. So you need trained staff. You require proper trained staff for that. So, and even the surgeons need training, which is a long learning curve. So all these things are mitigated with the biportal technique. So in biportal technique, we have a wide area of exposure, because one hand is holding the camera. So the other things, the hand is free to go over and do. So I think biportal technique is not inferior to monoportal. So at the same time, I don't say monoportal is a bad technique, because I do both. So I find biportal having specific advantages, especially with fixations, stenosis surgery. In stenosis surgery, monoportal have limitations, we all know. So if you see how the movement and all, the instrument movement and all will be limited in monoportals for stenosis surgeries. So the biportal comes a long way. So I think it will replace, maybe because of the advantage I told you. In future, maybe it may replace monoportal, but it's not an inferior technique, or it's not something like added to monoportal. It's a full-fledged endoscopic technique. Some people say it's half endoscopy. No, it's not half endoscopy. It's a full endoscopy.
Okay, thank you. Now, though the biportal endoscopy are now covering like more than 90% of the pathologies, but both monoportal and biportal share different areas. And also, PONS is also devoted itself to providing more and more RF plasma products and instruments to help UB surgeons to do the surgery. And I think both patients and surgeons can benefit from this UB technique. Okay. And next, how do you feel about this first UBECON International Conference in Nepal? And do you have anything to say to this conference, to wish its success, or to show some more expectations?
Yeah, first of all, I congratulate Nikunj for organizing the conference through Nepal Endoscopic Society, and I congratulate Bonds people also for their cooperation to Dr. Nikunj for this conference. It's a huge success in my view, because it's not why I'm telling it a huge success. It was a good learning platform from everyone. So the beginners came, the beginners who started the technique, they came. They were able to ask the questions, their doubts without any hesitation. So we could answer. We had some doubts in spite of doing so many cases. We had some doubts. We could exchange the information. So it was a dynamic flow of information and knowledge, so between the people. So it was an excellent conference for me, as well as if I see myself as a beginner. So also I feel this conference is very successful because in this conference from the basic techniques to advanced we discussed advanced techniques, everything was discussed. And so my mentor Dr. Yang came. I was more happy for him because he demonstrated his technique also. So this is a huge success. And recording suggestions for the future conference, yes, so this should be an event which is happening more frequently, and as the speakers are actively engaged now, so some new people will come, they get more chances to speak and to learn from such conferences.
Yes, such kind of conferences are valuable chances for surgeons to gather around, to exchange ideas, right? And I hope that you can be more and more shining in UB area. Okay.
Yeah.
Thank you for your time.